Assalamu alaikum and very good afternoon. I would like to welcome you all to the special Summer Health with Prime webinar. And thank you for joining us today. I'm Dr. Asia, Assistant Medical Director and General Practitioner at Prime Health. We're live from our official social media platforms, including YouTube, Facebook, Twitter, and of course, LinkedIn. It's a well-known fact that summer brings with it a separate list of health concerns, primarily fatigue and skin problems. Getting health information is so easy with today's technology and it's so quick to browse anything. But having a specialist answer questions correctly makes a significant difference. Today's webinar is a public demand topic, and as you all know at Prime, we value personalized care personally. I have two experienced doctors from different specialties with me today. For all viewers, be prepared with your health-related questions. Let me introduce my first speaker on this webinar today. We have with us Dr. Mohammed Zaqout, internal medicine consultant at Prime Hospital, have over 20 years experience in working in different internal medicine departments, expertise in managing and diagnosing different medical illness, including diabetes mellitus, hypertension or high blood pressure, high cholesterol levels, gastrointestinal problems, respiratory problems, rheumatological problems, and different infectious diseases. Welcome, doctor.
Welcome.
Thank you. And I now would like to introduce my second speaker, Dr. Saher Alsalloum. Hello, doctor.
Hi, doctor.
Dr. Saher is a Syrian board certified dermatologist and venereologist and a member of American Academy of Aesthetic Medicine. He has been with Prime for more than 9 years and treats all types of skin conditions and sexually transmitted diseases as well. Highly experienced in all cosmetic and dermatological procedures. For all the audience, if you have any health-related question, please feel free to write in the comment box so that our specialist can get back to you at the same time. So let us start the topic for today with Dr. Zaqout. Dr. Zaqout, as we all know, the webinar is all about summer health. You being consultant for so long time and experience, so we will definitely start with common health summer problems. What you generally face in OPDs?
Yeah, well, summer season, as you said, would carry sometimes major health problems, and we have to be alert for some problems which occur in normal people and in children and in people, elderly people, especially those with the chronic comorbid diseases like cardiovascular diseases and diabetes mellitus and other medical conditions. So there is a concern of certain conditions which can occur in summer. One of the most important things and concerning things is hyperthermia, which we call heat illnesses, which is ranging from mild heat illnesses up to heat stroke, which is a very serious and critical condition. And also patients with pre-existing medical diseases, they could have exacerbation of their diseases because of high heat and the humidity, which could alter their course of illnesses and cause exacerbations, making them go to the hospitals. So
Doctor, I just have a quick question here. Sorry to interrupt you. Now, when we talk about heat related medical problems, can we really make it simple for our audience to understand the difference between heat exhaustion, heat intolerance, and actually heat stroke? What is the major difference, and how should they go ahead with it?
Yeah, so heat illness is ranging from mild form, which is we call as heat cramps or heat intolerance or heat tetany. It occurs when the patient or the person is exposed to high temperature, either by direct exposure to the sun or in high environmental places. This is mild form of heat illnesses which can be managed by the person himself. When he started to feel him fatigued and tired, he can manage himself by removing himself from this environment. This can progress to heat exhaustion, actually, which is a precursor of heat stroke. And heat exhaustion is also a serious condition which should be recognized and treated rapidly. And if the person who is having heat exhaustion continue to have it, he can progress to heat stroke, which is the most important and most critical condition. In certain conditions, if not recognized and there is delay in treatment, it can cause actually death and mortalities in some people.
Thank you, doctor, for that answer. Now, since we will also, now I'd like to ask Dr. Saher, since it's summer and a lot of questions, including me, let us begin with, in the skin there are several layers, and what are these layers, and what was done with skin? How does skin play a very crucial role to human health?
Hello, can you hear me?
Yeah, did you hear my question, doctor, or should I repeat?
Yes, doctor. There are actually three main layers. The outermost layer of the skin is the epidermis, and the second one is the dermis, which composed of collagen mainly, and the third one is the subcutaneous fat. The three most important functions for epidermis are number one, protection. Actually, protection of the environmental injuries or insults. It is the main function of the epidermis. Also, prevention of water loss and immune surveillance. There are some cells in our skin called Langerhans cells. That's the function of Langerhans. The dermis also play a main role in regulating our body temperature by controlling the skin blood flow and sweating. It is also has a mechanical protection of the underlying structure through the collagen and hyaluronic acid. The skin also senses come mainly from the nerves in the dermis. Finally, the subcutaneous tissue serves like as a heat insulator and shock absorber, in addition to its main role as an energy reserve.
I think a lot of roles which probably everybody needs to understand. So I just have one question from the audience, Dr. Saher. Probably we can answer this. How can we avoid hyperpigmentation during summer, as we are out of most of the time?
Apply more sunscreens. Use more sunscreens. Avoid sun exposure as possible. There are so many things we can talk through this webinar about how to do that, how to make more protection of the sun, but mainly apply sunscreens and avoid the direct sunlight exposure.
Great. So I think this sunscreen is a huge topic to discuss. I just want to ask Dr. Zaqout again that people who have diabetes, do they really need to care on a special point of view during summers? Are they, related to water or any health concerns they should be really worried about?
Yeah, actually, diabetes mellitus, it depends. If they have type 1 diabetes mellitus or they have type 2 diabetes, it also depends on the long-standing period of diabetes, if they have for many years or it is a new onset diabetes. So patients with type 2 diabetes, for example, they have a long history of diabetes mellitus. They are exposed to certain complications of diabetes mellitus on their skin. They could have dry skin and this can alter the heat treatment of their bodies when they are exposed to heat. And especially if they have uncontrolled diabetes mellitus, they could have which we call hyperosmolar diuresis. They can lose fluid and they are dehydrated. And when they are exposed to heat weather, they could have more dehydration, and this could alter their organ system, especially kidneys and heart.
So what should they do, doctor? What should they do to prevent this?
Yeah, the most important thing to do that is to avoid exposure as possible as they can to heat environment and to direct skin exposure, and to drink plenty of fluids if they don't have comorbid diseases in the heart like heart failure, and to make fluid drinking on a schedule, not just on when they are feeling themselves thirst, so they can take fluid regularly through the day, and to take their medication well, and to check their sugars regularly throughout the day of heat,
So
because
if you feel, yeah, yes, doctor. If a person is diabetic and there are chances of dehydration, like he is probably a labor or working outside most of the time in sun, it is very difficult for a person to carry the glucometer and keep on checking. Any special advice for them?
no, the special advice is not to do strenuous exercise, as not to expose to hypoglycemic events. This is the most important thing for them, actually.
Okay. Dr. Saher, in summer, what are the most common skin problems you face in OPD, and people generally come with that problems? If we have a number of things so that our audience can connect to that.
Yeah, sunburn is the most common problem actually. Sunburn. In addition to that, we see actually flares of different skin diseases, inflammatory diseases, for example, lupus, which is an autoimmune disease. We see also more infections, fungal infections, especially the tinea versicolor, which is very common actually. Bacterial infections, like we see more boils, even some diseases like this hydrotic eczema, because of the sweat glands are more active. We see
So,
also
sorry,
flares of
doctor, what is
acne.
this? Sorry, doctor, what is this eczema? Sorry, I want my audience to understand what is the eczema.
There is a kind of eczema called dyshydrotic eczema or dyshydrosis. It's simply when we have blocked sweat glands, and that disease might get triggered in summertime because of heat and humidity. Our sweat glands start to work more actively, then there is more chance to trigger this problem, which is already there. I mean, we might have it, but it will be more common or it will trigger more in summertime. Dyshydrotic eczema or dyshydrotic dermatitis.
So, what are the common symptoms people should not miss and use over-the-counter medication, and they should actually see the dermatologist or the specialist for the first aid?
The common, doctor, again?
So, So, out of all these lists, what is the really an emergency situation where patients should not take self-medication or over-the-counter medication like aloe vera gels or anything, and should actually reach to the dermatologist?
For the simple sunburn, doctor, it can be treated at home, but for the major sunburn, it's better to visit the doctor to evaluate the case. Sometimes you have to give steroids or anti-inflammatory oral treatment. Sometimes it might reach till second degree. It is actually first degree, but sometimes it's really severe. When a patient feels that the sunburn is really severe, we have some swelling also, it's better to visit the clinic.
We have a similar question. I think most of the sunlight allergy, like severe itching, blister, redness, how treat that one? So, Dr. Saher, would you like to answer this question? Yeah, please.
According to the case, there is no, first we have to put the diagnosis, then we decide. There is no like general treatment for the rash in summertime.
Okay, fine. Dr. Zaqout, since we talk about diabetes, I would like to know also about people living with high blood pressures. Generally in summers, their blood pressure goes down or it goes further high. And what are the recommendations for them?
Indeed, patients with the blood pressure, when they are exposed to heat because of the physiological process which happened in our bodies to cool our bodies, it consists of the main mechanism is peripheral vasodilation. That means the vessels became wide, and this can cause their blood pressure to go down a little bit. But the most important thing is patient's medications who are the patient is receiving for his high blood pressure. For example, we used to use diuretic therapy and beta blockers in certain patients with high blood pressure. And these medications actually, for example, beta blocker, they alter the skin function and make the body is not able to cool himself properly. And patients who are taking diuretics, they are exposed to dehydration more than those who are not taking diuretic therapy. So the other thing in patients with high blood pressure is there any concomitant cardiac illness beside it, for example, heart failure or coronary artery disease? Because when the body starts to regulate his temperature, there is an order to the heart to pump blood more to our peripheral vessels. So if our heart is weak, it will cause heart congestion and heart weakness more, and this could alter patient health condition in general.
So, Doctor, we have one question. What are the things we should do for someone with heat stroke? So, first of all, heat stroke, it should be very clear for everyone that is not heat exhaustion, or that is not the basic. That's actually an extreme thing. So, when a person is in a state of collapse or almost collapsing, so we would like to hear from you, Doctor. What are the first aid? What should be done to a particular person?
Yeah, first of all, if it is heat stroke, we have to always to remember that heat stroke should be treated in hospitals. It is not home treatment, it is not field treatment. But if the patient is having heat stroke at any time, immediately treatment should not be delayed until the arrival of help or until transportation to the hospital. So in the field, you can, the first of all is to remove the patient from the heat environment. Either the person was under sun exposure or not, to take him in air conditioning area as possible, to remove his clothes out off, and to start to cool his body. What mean you have if you have cold water or water, you can spray it on his skin. You can sponge water over his skin. You can use ice baths or pieces of ice to put it on large vessels like vessels in the neck, axilla, and the groin area, which is a very excellent way to cool the body because these are carrying the cold sensation and to the whole body organ and system. So, whatever possible to do these measures and to transfer to hospital as the help arrives, because heat stroke carries high risk of mortality and death actually. And death in heat stroke can occur in short time. It can happen in 30, 45 minutes if the patient has delayed of treatment and doesn't arrive to the hospital immediately.
So, and if the person is reaching on time to the hospital, luckily we are in a country where ambulance is a few minutes away. And how long it will take for a person to recover from the hospital itself, Doctor?
So usually, if the course will be smooth, usually the patient will take 1-2 days maximum. After in hospitals, they continue to call him and to give him to do investigations in order to exclude target organ damage like muscles, kidneys, and heart. And we start to replace these patients with the fluids and correct their electrolyte imbalances if they have. And actually, the course, the hospital stay, it depends on the severity and on the affection of organs. For example, heat stroke can cause rhabdomyolysis, and this can cause acute renal shutdown. And some patients might need dialysis for a while, for a period of time until they recover again. It can leave permanent damage. If the brain is affected, it also can cause residual brain deficit and sometimes also permanent damage. So the time of recovery will depend on the severity and the rapidity of the initiation of the treatment. If the
Absolutely,
patient
doctor. Absolutely. For all the viewers, it's very important to know that this is very hot summer, and the first sign probably they can look also for if the urine output is getting reduced, and that means your kidneys are also getting affected. So we should not wait. If even if we are symptomatically better. But whenever you feel any kind of dehydration, lethargy, or fatigue, you should always go to the hospital nearby or the medical center nearby. Now, with that, I would like to ask the question to Dr. Seher. It's a very important topic and especially topic of my interest as well. Why is sunscreens important, and what kind of sunscreens we should use in this summer?
Actually, there are two different types of sunscreens. Sunscreens are, in general, are agents to block the ultraviolet radiation absorption by the skin. So the physical one is stable. It do not break over time. So it doesn't has any risk of contact allergy. And no need to reapply it every 2 hours. And usually it protects from UVB and UVA, two different types of ultraviolet rays. And but the problem for physical sunscreens, it might leave a slightly makeup-based appearance that some people don't like. The chemical type of sunscreen do carry some low risk of contact allergy, and they degrade with the sun exposure. We have to reapply every 2 hours. But they are available in different types of formulations, such like creams, lotions, gels, and recently nowadays there are some chemical sunscreens which protect from block the UVB and UVA also. Um, in summertime we have to protect by sunscreens mainly, but actually not only sunscreen. The optimal sun protection includes wearing a hat, sunglasses, a long sleeved shirt, and long pants with tightly woven materials for greater protection. Actually, this is not the sunscreen job. We have to do protection. Then the remaining unprotected skin, we can apply the sunscreens.
Uh,
They are effectively protecting us from the ultraviolet radiation, which damages our DNA by releasing ultra free radicals.
Doctor, when we talk about sunscreens, do you really think it's important for men also to wear sunscreens, or it's only women who should continue buying?
Everyone should do sun protection by sunscreens and whatever we mentioned previously. Everyone, even actually even kids, we have to, whatever we apply, we follow for sun protection, we apply also for children. Everyone.
I'm sure there are. Is there any variation with children and adult group in choosing the SPF in this hot summer? What SPF they should buy actually, or they should always first consult the doctor, then they should go for any product?
Regarding the SPF, any SPF 50 or greater will be fine for any patient. There is no group related to the SPF. For all groups, starting from SPF 15 is okay. 15, not 50. 30 will be better, 50 or 50 plus will be also even better, but the difference actually is minimal between 15 and 50, not that major difference like the numbers let you think. Anyhow, we have to apply sunscreen with SPF 15 or greater, and it should protect from UVB and UVA. And it's better to avoid the sunscreens with fragrance, especially for kids. But for everyone, we should be careful about that. They might cause contact allergy because of the product itself.
And doctor, if there is already a sunburn, should we still continue applying sunscreens?
Yeah, it is very important. We should cover the burned area, and if we couldn't cover it, applying sunscreen, it is a must.
Thank you, doctor, for that. I have a question from Mr. Jihad. What are the foods, drinks should he avoid to clear his skin, especially during summertime?
What is the food?
Food or drinks should avoid to clear anybody's skin during summertime.
There is no
Probably
specific. There is no specific doctor rules about food and skin diseases in summer. Whatever is applied for skin allergies or any food-related disease applied in summer and winter. There is nothing more specific for summertime.
I would really request my audience to listen to these things very carefully because we live in the world of technologies and so much information is available. As I said in the beginning, also it's very important to directly hear from the specialist because a lot of information which is really not required to know because that's sometimes not correct also. So you should always we all have one doctor at least in our life. Please speak to them. I'm sure they will give you the better advice. Dr. Zaqout, we have one more question from the audience. Continuing our heat stroke topic, what are the things we should do for someone with heat stroke? We already talked. So, but how to prevent heat stroke? Like, what are the measures we should do every day so that we can actually, be away from heat stroke?
There are a lot of things. First of all, uh, we have two types of heat stroke, which we have to be alert of. One type, which we call the exertional related heat stroke, and this occur in young people categories who are practicing sport or do strenuous exercises through summer. So usually we advise these people to drink a plenty of water, to take frequent breaks during their work or during sport, and as I said, to drink fluid as a schedule, not only when they feel themselves thirst. To move from the hot area to more cold area and to cool themselves and then to return. So these things could be handled, and also in order to avoid direct sun exposure, they can wear hats or can wear light clothes and can use umbrellas in order to prevent sun exposure. The second category of
Absolutely.
people is an elderly people, especially those with comorbid disease and comorbid illnesses. They have low body sensitivity to heat and they cannot regenerate and they cool themselves like young people. So they are more exposed to complications from heat strokes. Sometimes they are not alert when they are sitting in prolonged time in heat environment, especially patients with diabetes, heart diseases, and other comorbid illnesses. Thus, we call non-exertional heat stroke. So it can happen even without exercising. And the other category is young children because their nervous system is not well developed and the sense for heat is not actually very good. So can easily they can get heat stroke and the problem. So we have to be alert and eyes open on these people. If our Baba, Mom, our children, to take care and not to leave them for a prolonged time in environmental heat, and to give them fluids always and to wash their bodies, especially children when they are playing with the fluids, with water and sometimes cold water.
So, doctor, how much amount of water is advised for any adult during this hot summer, especially in UAE?
Yeah, it ranges from 2 to 3 liters, maybe 3 liters, 3.5. It is good for them. They can maintain it on periodic time, you know. For example, every 10 minutes, every 15, every half to take fluid on schedule, right?
As you correctly mentioned that kidneys, get affected very early. Is there something we can do for the urine color that tells us that a person is dehydrated? Does urine color makes any significance of dehydration?
Sometimes can be significant, but it usually turns to red color or brown color when there is a material which we call hemoglobin, which is excreted in the urine, and this occur actually if rhabdomyolysis happens. And if rhabdomyolysis happens clinically, this patient will be manifested, will be clear, and he will be looked sick patient and with rhabdomyolysis and muscle cramps and muscle tetanus, and also he will have symptoms of central nervous system affection before the changing of his color of the urine. So yes, it can be a good sign and of severe heat exposure.
Thank you, doctor. We have a question from Mr. Albin. Viruses through small cut possibilities. I don't understand this question, but probably he's trying to ask, is there any chances that virus can enter the body if we have small cuts? So,
So most viruses enter our bodies through our respiratory tracts and our gastrointestinal tract. So the viruses which affect respiratory tract, like influenza viruses, it can also occur and happen in summer, and other viruses which can enter our gastrointestinal tract, our stomach and intestine. We can get it from foods. So the summer season is not an exception for affection of the respiratory viruses, especially influenza virus and other viruses. And we don't forget now we are in COVID area and in COVID era also. So respiratory symptoms might be related to COVID infection or usual influenza virus as well.
Thank you. Dr. Saher, we have a lot of health issues related to skin. What can be done to diagnose skin problems? Now, and what is the purpose of skin examination?
Yes, doctor. Again, can you tell me again, doctor?
What can be done to diagnose skin problems? Sometimes, diseases are not very visible and people don't know about it also, but there's something called dermatological skin examination. How do we do it, and who are the people who should come forward to check it?
Yes, doctor. Actually, it is very important to do physical examination first. By naked eye, first we do physical examination, and we can use also magnifier, or we can use even dermatoscope. We have a lot of tests we can perform to put the diagnosis also, including skin scribing for fungal infection, including buzz swab. It is a swab for called buzz culture and sensitivity to decide which bacteria is causing the problem, and also what could be the best antibiotic. We perform also. We take also the history from the patient. It is very important to know more information. I want to mention that, doctor, that we dermatologists, we don't put the diagnosis only by physical examination, not by only just have a look and decide what is the disease and what is the treatment. We need to know more information, like the duration of the disease, the history of the disease, the personal history of the patient. All matters to decide the diagnosis and to put the plan, also the treatment plan. We always face this, like in dermatology, the patient is coming and telling, what is this? Or what I will do? Like, doctor, just show the lesion and tell me what is this. We need more information. That's why also we don't like the online pictures, just to send the doctor WhatsApp picture and ask what is the disease. No, we need more examination to know where are the affected areas. So many information we know, in addition to the test I mentioned, to decide what is the disease and what is the best plan to treat the patient case.
So by all means, we should actually go to the skin specialist ones and not over-medicate or take self-medication as well. We have a similar question which you have already responded, doctor, but probably she's asking that can we use branded one or just normal one? So if you want to add more thing, we'll have some rapid questions after that, doctor.
Branded ones or normal sunscreens means?
Yes, doctor.
If the sunscreen
so branded is
good, no need to be branded. Any sunscreen works, actually. Branded is better, but anyhow, sunscreens in general in the market, they are good. Not only the SPF or the protection matters, also we have the quality of the product, because it might not suit to the patient's skin and might trigger acne or pimples. It might be very thick or oily. The quality of the ingredient and the quality of the formulation also matters. We can use anyone though.
Thank you. Dr. Zaqout, we will go very fast because I have a lot of questions to complete. So the another question is, what is the maximum range of distance coverage for the ambulance to reach in time? It's the other way around question.
Yes, so actually there is no definite range of distance. Whatever, as rapid as he reach the place. So I think every emergency room in hospitals are ready to receive these patients and to manage them and treat them properly. Right?
Absolutely. Even the ambulance will start the treatment itself at the same time. So
Yeah,
patient is
of
in
course.
safe hand. And luckily, we are living in a country which is just few minutes away. So it's just that the other questions is also very important from Mr. Jahad. Is there any difference in symptoms between heat stroke and stroke? These are very two different topics, but doctor can simplify it for us.
Yeah. Actually, there's a big difference between both. So heat stroke is related to heat exposure more, and it can cause. It is called heat stroke because the main symptoms of its presentation is neurological symptoms. The patient can present with decreased level of consciousness, fainting, agitations, and sometimes convulsion and coma. This is because of effect of heat over the brain tissues and sometimes electrolyte disturbances over the brain tissue, especially when our sodium in the body is becoming high because of dehydration. This alter our central nervous system function. The usual stroke, which we know is something absolutely different. It is related to thrombosis or atherosclerosis in our brain vessels, causing damage and death of the brain cells, and it occurs most commonly in patients with comorbid illnesses like hypertension and atherosclerotic heart disease and diabetes mellitus. So these are two different issues. Sometimes the presentation could be similar, but the etiology and the imaging studies and the treatment, of course, it differ a lot between these things.
So, continuing the same question, doctor, what are the main warning signs before an actual heat stroke can happen and to be avoided? I think doctor has already spoken, but actual heat stroke symptoms so that we don't reach to that level.
Yeah, it is, as I mentioned before, the heat exhaustion is a precursor of heat stroke, which started with excessive sweating, headaches, dizziness, sometimes fainting, and sometimes abdominal pain and vomiting. If these symptoms are not recognized and the person who are exposed to it continue to sit in heat environment or continue to do strenuous exercises. So this will go actually to heat stroke, which is characterized by more severe symptoms affecting his brain. Maybe it can develop up to convulsions and coma, and also his skin because of severe dehydration happening to him. Instead of excessive sweating, his skin became dry, and thus in this stage, this person is at a great risk of complications, so he should be treated immediately in the place, and treatment should not be delayed, and transfer him to the hospital also to continue
Thank
his treatment.
Thank you, doctor. Doctors, Saher, I would really like to know what are the most effective skincare routines during summer we can do.
Okay, in general, doctor, we should choose the proper face wash, the which suits our skin, and we have to use it twice, morning and evening. So simply morning we can wash and apply the sunscreen, and evening we can wash by that wash again and apply moisturizer. That's the simple basic routine. If we are not going out, instead of sunscreen, we can apply moisturizer. At night, there are some patients who needs special products like to treat acne or any special case. We can do it at night. It's preferred to be at night. So morning wash and sunscreen, evening wash and moisturizer or treatment. This is very simple routine we have to follow.
Okay. And as Miss Kausar is asking, pertaining to our answer, is sunscreen good for children? As she doesn't not believe that this can be good for kids. So
Is not good to use in kids due to many reasons. No, we have to use actually. It is very important. I want to mention something. Actually, more than 50% of the cumulative sun exposure on our skin, we get it before 40 years old, before that. So more than 50%. We have to be careful starting from we can start to apply sunscreens from the early childhood. It is very important. And you have to know also the sun damage is cumulative, means each dose adds up to even large or small, it will adds up and increase the damage.
We have a question from Miss Ala. Could you give example of chemical sunscreen that cannot need to reapply every 2 hours?
There are some commercial products in the market you can find in the market.
Okay, doctor. Which type of sunscreen to use, gel or cream?
You can use whatever you want, but in general, creams are better for oily skin, for normal to dry skin. And in general, gels are better for normal to oily skin.
Great. Dr. Zaqout, one question. What are the common diseases that can happen during the summer?
So most of all, the most important one, the issues what are happening in heat illnesses, which we are talked about. Other conditions which could happen in the summer season is exacerbation of already pre-existing diseases, like, for example, respiratory bronchial asthma, for example, which is heat and the humidity are enemies of patients with bronchial asthma, because if they are exposed to high humidity and heat, they could have frequent exacerbation of their illnesses. Also, foodborne diseases like food poisoning is twice common in summer season because we know that warm weather help the bacteria to multiply more. So the persons can be exposed to food poisoning and acute diarrheal illnesses manifested by watery diarrhea and abdominal cramps. And also some viral illnesses, as we mentioned, flu viruses and other viruses can affect, in addition to skin disorders, which Dr. Saher is talking about, of course.
Absolutely, doctor. We also know something called flu in summer. Is there flu in summers also? Anything you would like to talk on?
Yeah, that is for some it is strange to be affected with influenza virus in summer, but it is a usual virus which can happen also in summer as in winter, but in less frequency. And there is it has a normal course in summer like in winter, and can affect people, and the infection can be transmitted with the same ways and the same symptoms, and it does not differ a lot actually. But as I noticed that we are having COVID infections, and we have these are now considered to be flu summers, and every patient and every person who is having flu-like symptoms, he should be examined himself for COVID and to take his precaution measures and so on. All things we know about this.
Dr. Saher, some more questions. For oily skin, what should I need to apply for oily skin?
As a sunscreen, either choose the gel sunscreen as a gel, or you can check. There are different products they mention is specific for oily skin. Even some creams can be applied, or lotions, or even sprays. They mention clearly it is for oily skin. Gel is good, but there are some different formulations.
What's the difference between 15 and 50 SPF?
Yeah, actually the SPF, the sun protection factor, is a ratio between two numbers. The first number is the minimal dose of sunlight needed to cause redness in sunscreen protected skin, divided by the minimal dose of sunlight needed to cause redness in unprotected skin. It's a ratio. So the difference between 15 and 50 is just minimal. It's not that major. I will tell you, it's like 15. It gives around 93 protection, 93%. 30 protect like around 96 or 94. 50 or 50 plus even protect like 97%. So then that's the difference.
So
That's
we
why some
know
companies,
about
doctor, started to mention just 50 plus. No need to confuse
50
the
plus.
patient.
No need to
The
confuse the ratio.
90, SPF 90 or the SPF 100 gives the impression that I am 100% protected. That's why when I started to sell those products, sunscreens become more, because people, they apply and expose more to the sunlight, more than required.
Right. So is there a variation between white light color skin and dark color skin?
Yeah, for sure. This is called the phototype or Fitzpatrick phototype. Um, Usually patients, they ask, actually I'm waiting for this question, but not yet come. They ask for the skin type regarding oily or dry, but we'll talk now about the skin type, which is more important for us dermatologists. The phototype. There are 6 types, starting from the very white skin, type number 1, to the type number 6, which is the dark brown. The white one and the type 1, 2, and even 3, they are always burns, and they never tans. The first one, the type 1, never tan. Don't try to tan if you are very white. The number 6 tans darkly but never burns. And in between, we have 6 numbers. I will not go in to details, but I'll give some fast brief about the skin types. Actually, skin type 1 and 2 are on at highest risk of developing skin cancers. Type 3 and 6, or 3 to 4 actually, they are less prone to develop non-melanoma cancers, but they are still at risk of developing melanoma. 5 and 6, the dark skin, less exposed, or at less risk of having skin cancers. It is really a very important thing.
Okay. So okay, we have already covered this. I would like to ask this question to Dr. Zaqout. Is it wise to give oral fluids to the patient with extreme heat stroke, or do we have to wait for him to be hospitalized and will be given IV fluids?
Yeah, actually, if patients can tolerate and can take oral intake, there is no harm in take oral intake. But be aware, if your patient is dizzy and he's unconscious, don't try to give him any fluid per mouth, because he could vomit and he could aspirate, and this will harm him a lot. So it depends on your patient condition or the person condition. If he's conscious and he can take water, there is no harm to give it. If he is unconscious, don't try to give him per mouth anything, neither fluid or anything else, and try to cool his skin with the methods we know and we have explained it, and transfer him to hospital, and there they will put an IV cannula, or maybe in an ambulance they will put IV cannula and to start him to rehydrate him with sufficient amount of fluids. So this is the issue, and in hospitals they will replace him with his fluid uses as well, and if he has an abnormality, they will correct it.
Thank you. Well, as we're proceeding towards the end of session, so these questions I would really like to finish with a quick one, Dr. Saher. What precautions should we take for acne-prone skin during this summer so that the acne doesn't increase?
Use wash, because actually the heat and the humidity also trigger the oil production, the sebum production, and that's main triggering reason for acne. That's why we have more acne flares in summertime. So we need to remove that excessive sebum by using the wash more frequently, and do better sun protection, because the inflamed lesions will get triggered, and the pigmentation will get darker, and the sunlight is very harmful for the acne itself, and the acne treatment also. Do more protection and wash more frequently. This is the main things regarding acne.
So another question, it is advisable to use an hyaluronic product during summer?
We can use summer or winter. Hyaluronic products are good. They are very good moisturizers. They increase the water in the skin. Like so-called internal moisturizers, and it moisturizes from outside also. They are good anyhow, summer or winter.
Okay. So another thing is there any permanent remedy for keloids?
Permanent remedy for keloids. There is no permanent remedy for keloids. Actually, for keloids, it depends on the skin nature. There are different cases. I don't prefer to compare don't compare yourself with any other case, because sometimes you have severe cases with fast growing keloids, and sometimes you have keloid for years with the same size. Nothing special for that. The main treatment is cryotherapy and intralesion injection.
Thank you, doctor. One question I would like to ask from myself: what is your take on vitamin C products? Like even if it is like to be taken orally, we generally give it during upper respiratory tract infections, but people now use a lot of vitamin C serums. So medically, what should be the recommendation?
Vitamin C orally is better than topical use of vitamin C. Vitamin C is not stable, doctor. It should be manufactured properly to have a stable topical formulation, and that process is very costly and expensive. So many, unfortunately, formulations in the market, they are not effective. They are not effective enough. You can take it orally. It works as antioxidant. It's a very good antioxidant actually, and it helps to protect from against the photoaging, reducing the free radicals.
About today's webinar, I thoroughly enjoyed the session, and I believe we have covered at least some of the relevant and important information. But I would really request now my speakers for today to give some valuable take-home message, both the languages, Arabic and as well as English. I'll start with Dr. Zaqout first, please.
First of all, I wish you health and keep you safe and healthy. As we say, always water is life during summer. So always keep drinking water and take it regularly in order to avoid a lot of the problems you can expose to. Special care should be paid for elderly people with the chronic diseases and for children. Also for young people who are practicing sports and do strenuous exercises, they have always to take frequent breaks and to cool themselves in order not to progress to one of the complications of these heat problems. Always you can protect yourself by taking some clothes, like clothes, and cover your head with hats and so on. So we wish you all to get a good summer without problems, without complications, and without hospitals also. Right?
Thank you. And Dr. Same thing in Arabic, because most of our people would like to hear you in Arabic as well.
يس في فصل الصيف هذا فصل الحار جدا جدا موجود في كل العالم. الحرارة بالذات في الدول الأوروبية الآن تعاني كمان من الحرارة الشديدة. احنا لحسن الحظ موجودين في بلاد تعود فيها الشخص على الحرارة، وبالتالي مشاكل الحرارة إن شاء الله بتكون أقل بكثير، لكن هذا لا يعني إنه ما ناخذش احتياطاتنا. لازم ندير بالنا من التعرض للحر الشديد وعدم البقاء فترات طويلة في الجو الحار، الشرب المستمر للمياه، عناية خاصة بالأطفال وكبار السن والذين يعانون من أمراض مزمنة، لازم تكون عينينا عليهم دائما. نتمنى لكم الصحة والسلامة دائما في هذا الشهر، وإن شاء الله ربنا يبعدكم عن المستشفيات. We here in Ibrahim Hospital, we offer special care for patients. Our emergency team doctors are experienced doctors. They can handle and deal with these emergencies. So if anything, we are ready to receive you here and to manage you as well and to take care about you. Thank you for you all, and thank you, Dr. Asia.
Thank you. Dr. Saher, please.
Yeah, Doctor. Always protect yourself. Try to avoid going out in the peak time between the hours of 10 a.m. and 2 p.m. Try to plan for activities in the early morning or late afternoon. If you are out, protect yourself effectively by wearing hats, sunglasses, by clothing, and put good amount of sunscreens all over the skin. Rub that sunscreen and protect the skin evenly all over the exposed areas. Don't forget some patients, they put only small amount on the hand and they forget the other hand, or forget the other areas. So we see sunburn in funny shapes. And finally, stay healthy. In Arabic.
Yes, doctor.
حرارة الشمس قوية جدا هذا الصيف. الأشعة فوق البنفسجية مضرة جدا، في لها تأثيرات جانبية، تأثيرات هامة مباشرة، مثل التسمير اللي هو أذى وليس شيء جيد. التسمير خطر، التانينج خطر، السن أو حرق الشمس كمان هو شيء سيء. التأثيرات المتأخرة للشمس بتسبب شيخوخة جلد وتسرع بشيخوخة الجلد، وكمان لها دور مهم بسرطانات الجلد. فالله يحميكم وانتبهوا أكثر من أشعة الشمس. شكرا.
Doctor, if people want to book an appointment with you, I would like you to tell the audience that how they can reach to you. Which branch of
I'm available in Motor City and Mizhar every day. I work in both centers every day, one shift. So I'm every day available. They can book through the call center, the website, the WhatsApp, and inshallah I will help them.
Inshallah. And Dr. Zaqout, I really would appreciate your availability to the audience as well.
The times of work I'm hospital every day except Friday and Monday. This is my holiday days, and I'm available on other days of the week.
And thank you both the speakers. It was really lovely to have a session with you and to learn a lot of insights. With this, I thank all the viewers for their time and questions. It was really engaging, and we are not stopping here. We always have that connections with our people and new people who will be joining Prime. You can always email to us at myprime@primehealth.ae, and that's the easiest reach. Or also you can call us through our call center numbers, which we have already displayed. Other than this, if you have any questions, you can always connect to us through our social media channels. But most important is to take care of your health. The take-home message from me is that please follow appropriate recommendation from the doctors. They not the Google. Google is not the right idea. It's flooded with information, and mostly it's not correct, or it is not portrayed correct. So we always have a doctor nearby, and we always have one doctor in our life who can suggest better. Go for the appropriate treatment. We are living in a country which we have, where expertise really are good, and it really matters. And thank you so much. Take care of yourself, and have a good day and good life. Happy and healthy, and stay safe.
Thank you.